Age-related macular degeneration, or AMD as it is referred to, is a condition that damages the central retina known as the macula. AMD is the leading cause of legal blindness in the United States in patients over the age of 60, and the incidence of AMD increases with age. Here to talk about AMD, the importance of early detection, and the latest treatment options is Dr. John Myers, a board-certified ophthalmologist at Retina Specialty Institute. Thank you for being here.
Thank you, Jeff.
Well, I tried to explain, and I'm not certainly the expert, so why don't you do a better job and explain to everyone exactly what age-related macular degeneration is?
Age-related macular degeneration is, as you alluded to, a disease that affects the center part of the retina. We call that the macula. The macula is responsible for a detail vision, and degeneration, or just simple deterioration of that over time, affects our ability to see detail. And it's very evident in situations like reading and driving. But it is an aging process of the central retina that is in a couple of stages that we'll talk about. But overall, as we age, that macula becomes less able to perceive detail in some patients.
So that's really not something that's related to lifestyle or things like that? It's just an age issue, is that correct?
Well, the most common risk factor is an aging change. It really doesn't affect patients earlier than the age of 60, and as we get older, the prevalence is much more significant. However, there are other risk factors associated. There is a genetic component, we believe. There are also environmental factors such as sun exposure and cigarette smoking, and there's probably some vitamin and nutritional supplemental factors as well.
Well, you mentioned, I believe, different stages, or what about, are there different types? Is it one size fits all, or is everybody unique and there's different types of this?
That's a good question. It is actually the same disease process, but we talk about it in two different stages. And many of our viewers will recognize the two stages that we refer to being wet and dry macular degeneration.
Explain the difference in those two for the viewers that may not be as familiar with those terms.
Dry macular degeneration is the initial stage of macular degeneration, and it's simply an aging change that we can see in the center part of the retina. We see that as deposits within the retina called drusen, and over time that can develop into atrophy or loss of some of the cells in the center part of the retina. When we lose these cells, they don't grow back like skin cells would grow back. So you get a certain number, and as they deteriorate, that means your visual function can deteriorate as well. 90% of patients with macular degeneration are in this dry state. And it's a relatively stable state. Many patients don't even know they have macular degeneration when it is in the dry state. But over time, that can develop into more significant vision loss over many years, and it's only responsible for about 10% of severe vision loss.
Well, what other symptoms, are there any other symptoms besides vision loss? And what, you said, a lot of people don't realize they have it. They may think, well, I just, had to get reading glasses, right, and this is just part of it. And so how do they really know that there is a problem?
Well, the second stage of macular degeneration is the wet form of macular degeneration. And wet macular degeneration simply means that there is swelling or bleeding in the center part of the retina, hence wet. And it's because of abnormal blood vessels that develop under the retina. So patients who develop this second or more advanced stage would notice distortion of images potentially, or significant blurring of images that may occur over days to weeks or even months in some situations. And it is that change in the central vision, particularly distortion or progressive blurring, that would suggest a problem in the central retina.
Okay. Well, what kind of treatment options are available? What can people do to get back to normal?
Well, macular degeneration has been around a long time. However, we really just started treating it since 1985. And we started using laser therapy to destroy these abnormal blood vessels in wet macular degeneration. That has its benefits, and we still use laser therapy, but only in about 5% of patients. Now, since 2004, the first FDA-approved medical treatment of macular degeneration, we have been able to not only stabilize macular degeneration now 90% of the time, but in about 45% of patients we're actually able to improve vision. But it's a medication that we deliver into the eye in the office in a very comfortable procedure that allows us to deliver medicine that shrinks up these abnormal vessels, and it allows that fluid and the bleeding to regress, and we're able to preserve vision.
So you're actually putting the medication in the eye. It's not a oral supplement or
Correct.
a pill or something like that.
It does require the injection of a medicine into the eye, and it sounds a little bit intimidating. However, it's an extremely comfortable procedure when done in the office. We do a local anesthesia, and it's simply a small pinch of a medicine going into the eye.
Well, what kind of success have you had with that?
The success is now that 90% of the time we stabilize that process. And about 45% of the time we can actually improve that process. The downside to the treatment at this point is that it is required long term. And many of our patients really need treatment monthly to maintain that stability.
So it's an ongoing treatment. It's not a one-time deal. It's just a process that they would have to commit to.
Correct. Correct. Now, there are patients that we can get to a stability point that don't even need treatment. They simply need monitoring over time.
Well, what about supplements? We all hear about vitamins that will help for this or that. Is there anything out there that addresses this issue?
Absolutely. There are vitamin supplements that can help to slow down the process of age-related macular degeneration in its dry form to help us to prevent getting to the wet stage. And there's a study called the Age-Related Eye Diseases Study that has been looked at over 15 to 20 years. And we realized that vitamin supplements in ocular vitamins such as Ocuvite or eye caps can help to slow down that process and prevent the progression to wet macular degeneration. We are involved in many clinical trials in treating wet macular degeneration, and through Retina Specialty Institute we've been able to bring those to the panhandle. So we're actually looking for kind of the next phase of treatments that are helping us to get from this monthly treatment protocol to spread that out so that patients are still getting that benefit but not having to go into the doctor's office so frequently.
Well, is this something that people tend to notice and bring up to their family doctor, or when they're changing glasses? How does this process kind of evolve and get to you guys and really get some help?
Unfortunately, at this point, many of the patients that get to us get there because they have advanced wet macular degeneration. So our goal as retina specialists is to try and move that bar a little bit forward. Let's diagnose those patients with significant or high-risk macular degeneration much earlier. So it is important that a patient have a routine dilated eye examination. And it's important that they be dilated so that the details of the macula can be studied. Because if we can catch wet macular degeneration at its earliest form, and that is done by really evaluating the subtleties between the two, then we can begin treatment earlier, and these patients do much better. So good yearly dilated eye examinations. And if you have a diagnosis of macular degeneration, see your retina specialist. Great information.
Right here before we go, where can our viewers get more information?
We have a website, retinaspecialtyinstitute.com. And I think it's important that they can go there. And there's a general website called amd.org that talks about macular degeneration as a whole.
Okay. Well, thank you, Dr. Myers. We appreciate it.